Technique for setting up a sterile field, presented for Hartnell College by Brett Parker, October 19, 2018. Infection control and prevention is the responsibility of every member of the healthcare team. Bacteria are everywhere. To protect patients from harmful bacteria and other pathogens during medical procedures, healthcare providers use aseptic technique. It means using practices and procedures to prevent contamination from pathogens. This involves applying the strictest rules to minimize the risk of infection. Following aseptic technique helps prevent the spread of pathogens that cause infection. As healthcare professionals, we commonly use this technique when we're handling surgical equipment, whether we're helping with a baby's birth by vaginal delivery, handling dialysis catheters, doing a sterile central line dressing change, or inserting a Foley catheter. Environmental controls include maintaining that sterile environment by keeping doors shut during procedures. The more people present, the more opportunities for bacteria to cause contamination. Contact guidelines ensure that when we are sterile, we only touch sterile items. We do not touch any non-sterile items. We will now set up a sterile field using aseptic technique. We will go over the items listed on this slide to identify how the sterile field is maintained during the establishment of our sterile field. Disclaimers: always review and follow your hospital policy, check safety considerations, double check with your physician and other policies and procedures, instruct your patient on how they may assist you throughout the position by laying still, etc. If required, check the dressing on the wound and assess required supplies needed for the procedure. So the first step is to perform hand hygiene. Get your supplies, check your equipment for sterility, and gather additional supplies to help you save time. Place the package on a clean, dry, waste-labeled table like a mayo stand. A clean, dry surface is required to set up the sterile field for sure. Remove the outside sterile packaging and discard to give you more room for setup. Grasp the outer surfaces with the outermost tip, then fold the flap away from you, taking care not to cross over the sterile field as you will contaminate it. Remember, the 1-inch border on the field is considered non-sterile. Next, grab the side flaps and open them outwards and let them lie flat on the table, allowing gravity to let them lay flat. Do not press down on them, that will contaminate them. Only touch the 1-inch border on the sterile field. Do not reach over the sterile field at all. Grasping the outermost corner, pull that last flap towards you, keeping it from touching your body to maintain sterility. The step creates an open sterile field. Remove those 4 steps before opening the last flap to allow those to maneuver materials around on your new open sterile field. Sterility must be maintained when adding items to a sterile field. We can open packages and lightly drop them onto the field, but we cannot touch the field. We do not toss or fling anything onto the field. When we add fluid to containers, we're careful not to touch the receptacle edge. I would like to take a few minutes to answer any questions you may have about sterile fields at this time. There's a variety of ways to set up sterile fields. Many of them are the same. It depends on the procedure that's being performed. So please ask away, and then we will do a demonstration.